Tonight on KQED Newsroom, California records its first death from the coronavirus, and Governor Gavin Newsom declares a state of emergency to contain its spread. Plus, healthcare workers on the front line of treating coronavirus patients. How protected and prepared are they to fight the illness? Also, Joe Biden won big on Super Tuesday, but Bernie Sanders is projected to win the most delegates in California. We'll take a look at the race and other key local and statewide contests. Good evening and welcome to KQED Newsroom. I'm Priya David Clemens. We begin tonight with a look at the coronavirus outbreaks in California and the U.S. This week, Governor Gavin Newsom declared a state of emergency to obtain federal aid to contain the spread of the respiratory illness. And Mayor London Breed announced 2 novel coronavirus cases in San Francisco. Also, an elderly resident in Placer County died from the virus, the first such death in the state. The man who died had returned from a cruise to Mexico when he started experiencing symptoms. There are now at least 60 confirmed cases of coronavirus in California, second only to Washington State, where at least 14 people have died. Joining me now is KQED science reporter Lesley McClurg. Lesley, thank you for being with me today.
Yeah, my pleasure.
Let's start with this cruise ship. The man who died had just been on a cruise that went to Mexico. It came back, disembarked all the passengers, and then picked up another 2,500 passengers, went on to Hawaii. And on the way back, passengers started complaining of flu-like symptoms, things that seemed similar to COVID-19. So the ship is now offshore, and people are being tested on board. Tell me about the testing and also about the risk to those who weren't showing symptoms.
Yeah, so parajumpers came in yesterday and helped public officials lower off a helicopter and land on a ship. And I saw videos of that, and it was interesting to see a ship that was completely empty next to the pool. So all of those people are in their staterooms right now until we have more information about the test results. They're getting, room service and staying inside, watching television, hopefully, and staying away from each other. And so until we have more test results, we won't know how many people were infected. Hopefully, like you said, that person was on a previous voyage, not on this voyage, but there's a chance that people on this voyage could have been infected because people who were on the previous voyage that went to Mexico, some of those are on this voyage. So 60 people who were on their way to Mexico went to Hawaii and came back. So this ship, it's likely that there's some contamination, and we won't know until those test results come back.
And how many tests are being performed?
So last night, the Princess Cruises, which is the parent company of the Grand Princess, said that 45 people were tested. And those people were chosen because they demonstrated flu-like symptoms. They were coughing or sneezing, or there were people around them who were in close contact that could have been exposed.
Princess Cruise Line, this is the same cruise line that had a ship that was off the coast of Japan with a lot of cases. We had more than 700 passengers and crew members who tested positive.
Within 3,000.
Within 3,000.
That's a large number.
6 have died from that number. Is there something particular about this cruise line, or could this have happened with any ship company?
This could have happened on any ship, really. So this disease is transmitted via close contact. Most of the people who are getting sick are inside a house with someone else who is sick. So it's transmitted via coughs and sneezes, maybe touching the same surfaces. Think about a cruise ship like a big house with a bunch of passengers who are in the same buffet line. They're sitting next to each other on the pool. They're touching the same handrails, etc. And so a cruise ship is kind of like a petri dish for a virus to really go viral amongst the passengers and potentially infect a lot of people. So this could have happened on any large vessel.
Okay. Governor Gavin Newsom declared a state of emergency for California, and that gives us access to more resources and federal funding. It also helps to curb price gouging. During the press conference, he held up this bottle of hand sanitizer and said it was going for $17, which seems outrageous. One of the things that really was of note to me in that press conference and about this state of emergency is that the term goes all the way through September, which seems to indicate a long-term response.
Absolutely. We could be in this for quite a while. So typically a virus spreads, as we know. Cold and flu is generally passed in wintertime when it's dry and cold outside. Those viruses tend to go away because they don't transmit as well in hot and humid weather in the summertime, and then cold and flu season comes back. That's exactly what could happen with the coronavirus. We could see a pop now, a lot of people getting exposed and getting sick right now, and then another wave in the fall. And then there's the chance that this becomes one of the circulating bugs that we see on an annual basis, and it's endemic within our lives.
So San Francisco also announced the first 2 cases of coronavirus here, and San Francisco had already declared a state of emergency before before having any cases. What can you tell us about these 2 new cases and how those illnesses were contracted? We
don't know exactly how these people got sick. We think that these people probably got it in the community because from what we know right now, they didn't travel overseas to a place where there was an outbreak, and they weren't in contact with someone else who had traveled overseas in a place where there's an outbreak. So this likely demonstrates that it's spreading within the San Francisco area. One person is a woman in her 40s who is in fair condition. She's in a hospital in a situation where she's not going to pass it to other people. There are protections and protocols in place to protect her. The other person, unfortunately, is an older man in his 70s, and he is in a different hospital. He is in serious condition.
You know, we hear that it seems to affect older people more, but also people who have suppressed immune systems or pre-existing conditions in some way.
Yeah, like you said, so older people are generally getting hit the hardest, and people with pre-existing condition. That's a lot of people in the population that may have a pre-existing condition like diabetes, hypertension, people who smoke. This is an upper respiratory infection, and so people who have asthma or difficulty breathing anyways probably have conditions that are going to make them more sensitive to this virus. They should be taking the most precautions they can. You know, staying home, maybe avoiding some public places, making sure to wash your hands as often as possible. You know, do things that will help prevent you from getting sick. But most important, get some sleep, eat well, take care of yourself so that your system is, as well as it can, able to defend against this virus.
If you feel yourself getting sick, what should you be looking for when you're worried, maybe I have the new coronavirus?
Yeah, so it's going to be really difficult to tell if you have the coronavirus. There isn't some magical symptom that identifies this as the coronavirus via the cold or the flu. You're going to feel like you have the flu. So cough, fever, some people get a runny nose, very few actually, a sore throat. You're going to feel tired and sluggish. The best thing to do no matter what is to stay home. Don't infect other people, take care of yourself, rest and hydrate. If you start having trouble breathing, that's the time to call your doctor. Please call your doctor before you head immediately to the hospital. I have heard that hospitals are having trouble meeting the needs. Only head to the hospital if you would have gone to the hospital prior to the coronavirus outbreak. So only do that in an emergency-like situation. Try to call your doctor first and get their expertise.
And do you see it getting worse before it gets better?
I think what we're going to see is a lot more cases. And so we're going to see a pop. That's going to be scary. I think mentally we all need to prepare for a situation that's going to feel more scary likely than it is. We need to all remember that right now the flu is still a more dangerous and more threatening bug that's circulating and has been circulating among us. So we kind of need to step back, take a deep breath. If you're starting to feel anxious, if you're online and you're scrolling and you notice that you're starting to feel stressed, stress is one way that our systems become less able to fend off bugs. Take a deep breath, maybe go take a yoga class, meditate, get offline for a little while, and prepare for the situation to change and feel worse than it actually is.
KQED science reporter Lesley McClurg, thank you so much for being with us today.
Thank you. My pleasure.
There are more than 250 confirmed cases of coronavirus in the U.S., according to Johns Hopkins University. This week, a national nurses union announced the results of a survey given to nurses in 48 states. Among the findings, fewer than 1 in 5 said their employer has a plan for health workers with known or suspected exposure to the coronavirus. And only 30% said their employer has enough equipment to protect healthcare workers dealing with a surge in infections. With me now are Dr. Andrea Tenner, an associate professor of emergency medicine at UCSF, and Sandy Adler Killen, a registered nurse in the East Bay. Thank you both so much for being with me. Dr. Tenner, to you first. How concerned are you about your own personal safety in your work as an emergency room doctor at SF General?
I think that the reassuring thing for me is that coronavirus is spread in a similar way to influenza, to the common cold, and we know how to deal with that. So we have supplies of personal protective equipment, which are the N95 masks, the gowns, the gloves, at this time to try to help keep us safe. I think the thing that's more concerning to me is what is going to happen in the future if there's panic and people start buying up all of those supplies and we as healthcare providers can't get them.
And Sandy, you have a potential coronavirus case that you were just working on your last shift.
Yes.
Tell me about that case, how you took your own precautions, and what happened with the people around this potential individual who may have this virus in the facility.
So I came on shift yesterday morning and was told I was assigned to a patient who was a coronavirus rule-out. Now, important to remember that we have many patients that appear in the emergency room that we need to rule out. That's done very quickly and easily with a swab if they test positive for the flu. This particular individual met the criteria, so we instituted all of our procedures and protocols. He was put into an isolation room with an anteroom so that we could manage his care and keep ourselves safe and keep the rest of the emergency room safe.
Do you feel that if there are more patients coming, that your hospital is ready to deal with that?
So because we are in surge mode at this time already, this is standard this time of year with the regular flu, we are already at capacity, and in terms of being able to support all of the individuals that are coming in because of the fear that you mentioned, I am concerned that we'll run out of staff, we'll run out of supplies to be able to support not only those individuals that potentially could have coronavirus, but our regular patients, our patient population that's very sick.
And since our resources are limited and the test kits at this point are limited, Dr. Tenner, as an emergency room doctor at SF General, what criteria do you use to determine whether or not someone should be tested?
So for us, what we're doing is we're assessing the patients for all possibilities. So do they have influenza? Do they have the common cold? How sick are they? And what level of care do we need to give them? We work closely with the Department of Public Health because they can do the testing. We have a very limited number of kits, so we are testing only the sickest patients, the ones who are going to be hospitalized, and the ones who we need to know if they have coronavirus to protect others around them, so that the healthcare workers involved in their care. There's some variability in the Department of Public Health testing, as this is a new thing for all of us, and so we're adjusting as we get more information. And that's, I think, why it's sometimes hard to get a grasp on what's going on with this, because as new information is coming out, we're adapting our systems of work. But I think the important thing for people to know is that we're not testing everybody that comes in and is concerned. We don't have a treatment for this, a specific treatment. It's all the things your mom told you: drink plenty of fluids, take care of yourself, rest. If you get sicker than that, then we have to give you supportive care in the hospital. And that just means we're giving your body the best chance we can for you to get over the virus, for your body's immune system to take over the virus. So I think it's really important for people to understand that if you feel you're sick enough to go to a hospital, you should go to a hospital. If you have difficulty breathing, you should go to a hospital. But if you feel like you're not feeling well, but you're worried about coronavirus, it's very low likelihood that at this point we're going to be able to test you. So the best thing is to stay at home, take care of yourself, call your doctor, call helplines that may be available to you through your insurance. But again, managing that like we normally would for flu, for cold, any virus.
Sandy, let's talk a little bit about masks, because this is a big topic. People are concerned that there aren't enough masks for them out in the public, that they're running out of them in stores or online, and also whether or not healthcare workers have enough masks. What's your experience with wearing a mask, with having enough masks at the hospital?
Yes, so prior to treating this patient, I worked in triage, and when I was in triage, we had many individuals coming up and trying to grab our supplies of masks, trying to hoard them. So I had to educate them and let them know that utilizing a mask, unless you're symptomatic, family members are having symptoms, it's not what we want to do in terms of protecting ourselves. The triage nurses, the staff, we're not wearing masks ourselves. So at this point, we're just emphasizing, please, just really extensive hand washing. That's how we're going to prevent the spread of this. And then, of course, not panicking. So in terms of caring for my patient yesterday, what I found really interesting is that we didn't have sufficient supplies in the room that I was utilizing to don and doff my equipment to be secure in making sure that I wasn't going to be exposed to this disease or transmit it to other individuals. And so we had to keep leaving the area to get additional supplies that were being sequestered in the manager's office.
So they're really carefully being monitored at this point.
Absolutely.
Sandy, how are hospitals preparing, and how can hospitals prepare for a surge in new cases?
So if we do end up having a surge, we're a small hospital and we don't have the capacity to treat many individuals. We only have 2 isolation rooms. So this would be treated as a disaster, and we're very trained in terms of disaster response. So we would set up tents outside. We can even have an ICU set up outside if that was necessary.
Dr. Tenner, do you have concerns about people using the emergency room as the first point of contact for people who think they may have the coronavirus?
Yeah, I think one of the challenges with any type of outbreak or any disaster like this is that people are afraid and they're not sure where to go. And I think one of the challenges with this is that it's hard to get information because information is constantly changing. And I don't want to discount the fear. That's very normal. When I first heard about coronavirus, I was nervous about it too. The way we combat that is through information. And so I think talking to your doctors, calling if you have symptoms or you're concerned about what you should do. And then the CDC website, the Department of Public Health websites, they all have good information. I think one of the key things, though, is with the emergency department, if you need to come to the emergency department because you feel you're having an emergency, we want to be there for you. But if you're concerned or you want to be tested, as we talked about before, that may not happen. And so if you can stay at home, staying at home to try to prevent spreading this to other people or getting infected is good. We're all in this together, and we need to work together to try to manage this.
Sandy, last word to you. What would you tell people who are worried or afraid about contracting the disease?
So my daughter asked me that same question. So she's going to be flying next week, and she said, "Mom, should I be worried?" She's 22 years old, and I said, first of all, you are not in the demographic of immunocompromised, of elderly, but the main thing is you don't need a mask. Just make sure you wash your hands and you'll be fine.
Dr. Andrea Tenner, Sandy Adler Killen, thank you both so much for being with me today.
Thank you.
Thank you.
You can sign up for text alerts about the coronavirus in San Francisco by texting COVID-19 SF to 888-777. On Tuesday, former Vice President Joe Biden won major victories in 10 of the 14 states that cast ballots in presidential primaries. Vermont Senator Bernie Sanders prevailed in his home state, as well as Utah and Colorado. He's also projected to win heavily in California, where 415 delegates are up for grabs. Also this week, former Mayor Mike Bloomberg and Senator Elizabeth Warren dropped out of the race. This is the first time that California has held its primary on Super Tuesday, moving it up from June. Voters across the state also decided the fate of local and statewide ballot measures, including Proposition 13, the largest school bond measure in state history, and a tax on vacant storefronts in San Francisco. Here to discuss this are KQED's Senior Editor of Politics and Government, Scott Schaefer, and KQED Politics and Government Correspondent, Marisa Lagos. Thank you both for being here.
Good to be here.
All right, so hot off of Super Tuesday, let's tackle the local issues first. So let's talk about Prop 13, which is on track to fail. Now, this is not the same Prop 13 that in 1978 capped property taxes. This is a bond measure that would have raised $15 billion for California schools, including community colleges and universities. Scott, talk us through this proposition and what happened.
Yeah, well, before the election, I think everyone thought this would be a slam dunk. We've passed statewide 5 school bond measures since 1998. This one was supported by Governor Newsom, unlike one in 2016, which Jerry Brown opposed. Voters passed it anyway. And so it seemed like, it was all green light all the way. And yet it's losing right now. There's still like 3.5 million or so ballots still to count, but it's behind 55-45 roughly. It's a bit of a mystery, but if you look at the local school bond measures throughout the state, about 70% of those lost as well. So there might have been some bond fatigue in general, maybe concerns about the economy turning down. But as you said, there was also this question about, were voters confused by the title, Prop 13, the number, because There's been a lot of talk about Prop 13. There's going to be a measure in November to reform the old Prop 13 from 1978, the property tax measure. So there might have been some confusion, and there's even talk now of retiring 13 as a proposition number, but just in case that was part of the confusion. But it just seems that for whatever reason, maybe it got overwhelmed by coronavirus and the presidential primary. The message never broke through. But in any case, it looks like it is going to fail.
It is interesting, especially since we weren't in a recession at the point when we're
Right.
So, Marisa, let's turn to San Francisco's Prop D measure. Now, this one needed a 2/3 majority to pass. It seems to have gotten that. This will allow the city to tax property owners who have their storefronts vacant, and it's a measure to fight blight as much as anything else. What will we see in terms of impact on this proposition? Where will we see it?
Yeah, I mean, I think that's going to really depend on how aggressive the city is at actually implementing this. So the idea behind this, and surprisingly, in a city like San Francisco, it had widespread support among both the progressive and more moderate sort of factions at City Hall, is that, you know, you do have, of course, retail is suffering right now, but in addition to that, you have a lot of landlords who seem to have been just allowing these storefronts to sit vacant. We're talking in neighborhoods near where we are right now, like North Beach. We're talking about in commercial quarters throughout the city, and there's a real concern by other merchants of what that does to their business and the property values. And so the idea is that if a property owner essentially, is given a warning and does not do something to fill that they can tax them and use that money to support small businesses. I think the hope is that you won't actually implement that tax. You will actually be getting these storefronts filled. And I think that there's some idea that maybe some of these property owners have been waiting for, a chain store or somebody who can pay this higher rent. And they're saying, just get a local business in there for the meantime and, help sort of juice these commercial quarters that are suffering.
Or don't kick them out by doubling
or
the
don't,
rent.
which I think is another issue. So this is sort of meant to be, I think, a little bit of a carrot and a stick for property owners.
So let's take a look down at Southern California now, Los Angeles County, where our former district attorney, George Gascon, was running for the DA's office there. So Gascon was positioning himself as the criminal justice reform candidate, and he was running against incumbent Jackie Lacey. That positioning of criminal justice reform worked well for Chesa Boudin up here, but it does not seem to have worked as well for Gascon.
Yeah, again, some ballots still to count. It looks like Jackie Lacey's at around 50.2% of the vote, so she, could avoid a runoff. She could win outright. There were two progressive candidates running against her, and she said, as she said, she was the first woman DA down there, first African American as well, running for a third term, I believe. And Gascon was really encouraged by criminal justice reform advocates because there was a sense that Jackie Lacey was just too traditional, tough on crime. She was still seeking the death penalty in a lot of cases. And so Gascon went down to challenge her. He left his job here in San Francisco. Yeah. And, it's hard, I think, to leave a county. There's a bit of a carpetbagging taint sometimes to it. If you add up both the votes he got and the votes the public defender who was running, also a progressive, they're close, to what Jackie Lacey got.
This could be a different situation.
It could be a different,
to a runoff, which I think it probably will.
Yeah.
Her numbers have just been declining since the election day.
Well, there was also that weird thing that happened just before the election with her husband came outside with a gun, threatening to shoot some Black Lives Matter protesters who were, in his defense, at his home, which is...
And sort of ironically watching this from here, as Gascon positions himself so far to the left and Black Lives Matter supports him down there, they were protesting him up here as well at his home. And that was one of the, I think, not the decision point, but I think one of the things that encouraged him and his wife to decide to leave San Francisco.
Interesting. So, how that all falls
together.
Yeah, absolutely. Marisa, let's turn to national politics now. There are two men left standing in the Democratic nominating process. When it comes to delegate math, where do we stand right now and what's coming up?
Yeah, so Joe Biden, former Vice President Joe Biden, has around 650 delegates as of now, and Bernie Sanders has about 573. That doesn't sound like a big gulf, right? But a lot of the states coming up do tend to favor Joe Biden. He did super well with voters of color, for example, in South Carolina. I think Michigan is going to be the next kind of big prize. And it just seems like at this point it is Biden's to lose.
Elizabeth Warren, she was the most recent candidate to drop out, right? And she had a lot going for her. She was a front-runner status for a while. She had a good ground game. She had strong policy ideas. She had decent funding, but she did not make a good showing anywhere in the early primary states. Scott, how much of that would you attribute to her performance and how much to gender bias?
Well, as the only guy here, I realize I'm on thin ice answering this question, and I'll let Marisa jump in too.
I gave it to you on purpose.
Yeah, no. I think there's no question that she faced gender bias, as did some of the other women who are running, Kirsten Gillibrand and Kamala Harris. There was Hillary Clinton lost in 2016. I think there was a lot of sense that it's really hard in this country, for some reason, for women to really win national elections, even though Hillary got 4 million more votes than Donald Trump. Won the popular vote, lost in the Electoral College. I think I feel in some ways like Elizabeth Warren's best self never came through, and I think some of that is because if you're a woman running, I think you have to sort of portray yourself in a certain way to look tough enough. And she had a great personal story. She was Betsy growing up in Oklahoma City. Her father, had health problems. They almost lost the home. And I felt that when she was talking about that and talking about her brothers being in the military, veterans, I felt like that really resonated.
Which she did on the stump.
She did on the stump.
And I think she connected with people. I think you're right. I think that and that might have been connected to her gender too, that she didn't want to come off as just a folksy candidate who can only talk about their personal things. I also think, if you look at, and I think gender was a huge part of this, I also think if you look at it coming in, Biden was the vice president for 8 years. He's been in politics for longer than I've been alive. Bernie Sanders has been a senator for over 30 years. These guys, and he built a coalition and a movement in 2016. They both had a natural base, and that base didn't seem willing to abandon them for Warren. And I think that there were elements of her campaign that could really speak to some of the voters that both of those people see as their bases, and she just didn't break through.
Let's take a look at what's coming up next week. There are 5 states voting, including Michigan, which is the biggest prize. What are the stakes for both Sanders and Biden?
Well, they're huge. I think this is a real opportunity for Joe Biden to put it away, in a sense. Bernie Sanders in 2016 won Michigan going away against Hillary Clinton. If in some way Joe Biden can beat him in Michigan, he's going to win in other states as well, down south. He'll do well, I think, Missouri, Washington State, North Dakota. So I hesitate to replace one conventional wisdom with another, because last week it looked like Bernie was going to run away with it. But, I do think that, as Marisa said, the math at this point could favor Biden, and if he can continue to roll up some wins, especially in Michigan, and on the flip side of that, I think, Sanders really needs to win in Michigan.
Okay. But who knows, because a week ago we thought Bernie Sanders was the nominee, so
the crystal ball is not working all that well. All right. Thank you both for being here today. I appreciate it. And for the latest election results of local and statewide races, go to kqed.org/elections. Thanks for being with me tonight. As always, you can find more of our coverage at kqed.org/kqed-newsroom. I'm Priya David Clemens. Thanks for joining us.